Hi, I'm Tara Johnston and I'm a nursing student, and today I'm going to be demonstrating an injection skill, and I'm going to be administering a TB test and also intramuscular injection. That's the track method. Okay, and so I'm going to show you the backs of my paper so that you know that there's nothing but the doctor's order and the MAR. And my first check, I'm going to be comparing the MAR with the doctor's order. And so on the MAR, I have Shirley Cost, and then on the doctor's order, I also have Shirley Cost. Date of birth 4/3/1987, and on the doctor's order, it's 4/3/1987. And on the MAR, it says that she has an allergic reaction to penicillin and furosemide. So it looks like she's here with a diagnosis of community-acquired pneumonia, and so she first will be getting the tuberculin purified protein derivative diluted at 0.1 milliliters, and that's just a one-time thing that it's administered. And it has on the doctor's orders the PPD, which is the tuberculin TB test, on the right inner arm. And then the second one is going to be Phenergan, and 25 milligrams intramuscular twice a day PRN, and this is a Z-track method, and that's going to be given at 10 a.m. and it's close to 10 a.m. here right now. And on the doctor's order, it says Phenergan 25 milligrams intramuscular twice a day PRN. It's a deep intramuscular, and it says please preferably Z-track method if administering this medication. And then the third one that I'm just going to be setting up and not administering is a ceftriaxone, 250 milligrams intramuscular, and that's also at 10 o'clock. And then the doctor's order says ceftriaxone 250 milligrams intramuscular, and so that matches. Okay, and then for my second check, I'm going to be checking the medication against the MAR. And oops. Okay, so my first thing that I'm going to do is just check my saline solution for an expiration date, and that's 7/2024. And here's the tuberculin and derivative protein derivative, and that has, it says a 10 milliliter multi-use vial. So this vial can be used again, and so after I open it and use what I need out of it, I'm going to sign and date it with the time so that the next person that uses it knows that it's been opened and when. And the expiration date on it is 10/20/2064, and it compares with the MAR with tuberculin purified protein derivative, and so then that one compares. And then I have the Phenergan, and that's 25 milligrams per milliliter on the bottle. Expiration date 3/20/33, and it compares with the MAR. It says Phenergan 25 milligrams intramuscular twice a day. Okay, and then I have the ceftriaxone, and this is going to be reconstituted, and with 10 milligrams of sterile water, and the expiration on here is 10/20/2023, and then it's ceftriaxone 250 milligrams intramuscular injection at 10 o'clock, and so that matches with the MAR. Okay, and then I'm going to sanitize my hands here, and then I'm going to put some gloves on and prepare the meds for Shirley. If my hands just aren't dry enough. Give them a minute. From the sanitizer. There. Okay. Okay, so first thing that I'm gonna do is I'm gonna prepare my tuberculin. Take the cover off that. I'm going to sanitize the top of this in a outward circular motion for 15 to 20 seconds. Okay, there's my 15 to 20 seconds. I'm going to get my injection needle. Okay, so I'm going to draw up my air here. So I'm going to put 0.1 of air. Okay. And then put my air in here. And then I'm going to turn it up. I'm going to go a little past the 0.1 just so I can get the air bubbles out. If I have any air in it. Okay, I got my air bubbles out, and then I got my 0.1. Recap that. And then I'm going to get my sticker for that. I have tuberculin on there and 0.1 milliliters and my initials and then the date and the time that I'm giving it. So it'll be 10 a.m. Okay. And then for the second one, I'm going to do Phenergan. I can't get it. Just wants to stick in the top here. Okay. All right, and then first I'm going to get my needle ready for that one. Okay, then I'm going to clean the top of the bottle to make sure that there's a white line here on the top of the bottle, which there is. 15 to 20 seconds. I'm going to clean the top of the neck of the bottle, top of the bottle here. Okay. And then I'm going to take this gauze pad here and I'm going to break the bottle away from my body. Goes in the sharps container. Okay. I'm going to try to withdraw this without touching the edges of the bottle. Okay, I'm going to kind of turn it sideways here. Make sure I get it all out. I got quite a bit of air in here, so I'm going to try to get some of the air out. Okay. I'm going to recap that, switch my needle, and then I'll get all the air out. After I switch my needle, I'm going to pull back a little bit on it before switching my needle. Okay. I'm just going to I'm going to take my cap off here, get my air out. Okay. And then I have my 1 milliliter there. Okay, I'm going to recap that. And I did the dimensional analysis on that. I don't know if I mentioned that earlier for the Finnegan. And it was 1 milliliter. And then I have my initials, date, and time on my sticker. Okay, and then I'm going to put this stuff in the sharps container. Okay, and then the third one I'm going to be doing is the ceftriaxone. So I'm going to take my 2 bottles of that. I'm going to sanitize them. And an outward motion, 15 to 20 seconds here for this one. Okay. And then another 15 to 20 seconds on this one. That outward motion. Okay. So first I'm going to withdraw my saline solution. Okay. Put my needle on here. And for video purposes, I only have a 5 milliliter syringe here. So I'm going to have to withdraw saline solution twice to reconstitute. Okay, so I'm going to put my first 5 milliliters of air in there. All right, there we go. Okay. Okay, and then I'm going to put the second 5 milliliters of air in there. Okay. Okay. And then I'm going to withdraw 5 milliliters of solution here. I'll pull my needle out on now. I'm actually going to do a little bit more just to make sure that I have enough. Okay. milliliters. Can you see it? There. Okay. Oh, so shaky. Okay, and then I'm gonna withdraw another 5 milliliters of saline. Okay. Oh, I didn't quite get 5 milliliters. No, still not enough. Oh. Because I was just withdrawing air. Good one. Okay. Okay. Okay, and then I'm going to recap this needle. And then I'm going to mix my solution up a little bit here. Okay, and then that looks pretty much mixed up here. I had a little powder in the bottom. Okay. Then I'm going to re-sanitize the top of my ceftriaxons just in case, 15 to 20 seconds that I touch the area while I was mixing it. My hands. Okay. Oh, you know what? I'm doing this wrong. I have to switch my needles first. Or switch my... So I'm going to take my needle off of here and put it on this one. Put it on the wrong one. And I did my dimensional analysis on this, so I know that I have to draw out 0.5 milliliters of solution. And I'm just going to draw a little bit more. Okay, so that I know I have enough. Okay. And then we'll recap that. And then I'm just gonna show you that I have the 0.5 in there. Then I'm gonna draw back a little bit on that so that I can switch needles for the injection. My injection needle on. Okay. And then I'm just gonna take my air out of there. Okay. 0.5 then. And then I'm gonna put my label on it. Ceftriaxone 0.5 milliliters. My initials, the date and the time. So I won't be administering this one, but okay, I'm gonna get rid of some of my needles here. So this one's not open. And this is just and I'm gonna re-sanitize because I'm going out into the hallway here, into the room. Hands dry a little bit. Okay, and I'm just gonna knock on her door here. Shirley. Hi Shirley, I'm Tara and I'm a student nurse, and today I'm gonna be administering 2 injections. One is gonna be here on your 3 fingers down from your chromium process. It's an intramuscular injection and it's for nausea, and it's called Phenergan. And then I'm just going to check your bracelet here to verify. Your name is Shirley Cost and your date of birth is 4/3/1987. Is that right, Shirley? Okay. And then I have allergies to penicillin and furosemide. And then like I said, I was going to be administering the Phenergan intramuscular Z-Track method in your arm. And I have your Phenergan here. And then I'm also going to be administering tuberculin in your forearm, and that's a TB test. It's a purified protein derivative, and it's diluted 0.1 milliliters, and that's just a one-time thing. Okay, so I'm going to scan your bracelet here, and then I'm going to scan the meds. That was cute, upside down. Okay, and everything came up here fine with that. And then, so first I'm going to get my gloves. Are you feeling okay, Shirley? You are? Okay, that's good. My hands are still kind of sweaty and wet. It's hard to get the gloves on when they're like that. Still kind of damp. Okay, there, now I got the gloves on. Okay, so I'm going to sanitize the area here for the Phenergan injection. 15 to 20 seconds. I'm going to rub this area and clean it. Okay, 15 to 20 seconds. Okay. Oh, kind of move this here. Almost lost that. And I'm going to remove my sticker just so it doesn't get in the way of the injection. Okay. You ready, Shirley? 1, 2, 3. Okay, and then I'm just gonna kind of hold a gauze pad on there, just so that I'm not gonna rub the area because of the Z-track method, but I'm just gonna put a little bit of pressure to make sure the solution stays in. Okay. And then I'm gonna move my thing here down to the bottom so that I can do her TB test. On her inner forearm. Okay. I'm gonna take my alcohol swab and sanitize for my 15 to 20 seconds. And this is a TB test, Shirley. So I'm just gonna take my sticker off of here so that doesn't get in the way. Okay. All right, Shirley. Okay. Okay, and then I'm going to take my gauze pad, just pat her on there. Make sure that is okay. And then I'm going to circle the blip here with a pen, and then I'm going to put the date. So it'll be 10, 19, 20. The time, 10 a.m. And then my initials, which the pen doesn't work so good, but it's all on there. See my circle. Okay, and then I'm going to document everything on my paper that I administered injections. And then I'm going to ask Shirley, so I signed for everything. And then I'm going to ask Shirley, is everything okay? Are you feeling okay, Shirley? Okay, I'll come back and check on you in 15 to 20 minutes. Make sure you're okay. And then here's your call light. And if you need anything, let me know. Put your bed down to the floor. And then I will see you shortly.